Inverbis allows analyzing and predicting the behavior of all types of hospital management processes. Protocol compliance, comparative performance analysis between work centers, teams, etc. Analysis of alternative clinical pathways in terms of cost and patient experience. This video shows cases: protocol compliance in surgical prophylaxis, comparison of admissions for consultations in different hospitals, analysis of slow and fast tracks for specific cancer treatment access. Protocol compliance. The expected execution is represented by a BPMN notation model that is loaded into the tool. Inverbis allows detecting differences between the expected and the actual processes. In this case, it is seen that in most cases, the defined procedure is not followed. It is found that only 23% of cases comply with the expected sequence. The surgical prophylaxis protocol requires the administration of medication within a specific time window before the intervention. The data shows that in a high number of cases, patients go directly from hospital admission to operating room entry. The medication administration activity is not performed, and therefore compliance with the prophylaxis protocol is not recorded. Next, Inverbis can detect the causes of non-compliance. In the data used, it occurs more frequently in certain services, certain work teams, etc. Protocol compliance monitoring. With Inverbis, the process of improvement for this non-compliance can be monitored with the desired frequency. Users can follow it through a dashboard directly connected to the application. The image shows that more than 33% of patients do not have the administration of medication recorded, and this occurs more in orthopedic surgery patients. Inverbis allows setting alerts to warn of protocol breaches as they occur. Analysis of the consultation process in different hospitals. Inverbis analyzes the sequence of actions and the durations of the different steps of a process like this one of outpatient consultations. Undesired activity repetitions can be identified, and we can compare how this same process is executed in different hospital centers. Real-time monitoring also allows comparison between different hospitals, services, or any organizational unit. We can monitor and predict compliance with critical SLAs or KPIs. Thus, it is possible to act when we are at risk of non-compliance thanks to the creation of alerts. Analysis of clinical pathways, colon cancer. Inverbis can compare alternative clinical pathways and patient experiences, detecting differences and evaluating costs. The standard pathway is obviously slower than the fast one. The interest of the analysis increases when we detect the points and causes that increase delay time by any of the pathways. In this case, patients experience a delay between the visit to the family doctor and the first colonoscopy longer than the 14-day target in 97% of cases. With Inverbis, through dashboards, we can detect that patients on the fast track have a significantly lower average number of visits to the internal medicine specialist, 2.44 compared to 8.15. Inverbis can extract keywords stored as free text in the database to enrich the analysis. We can then capture concordant symptoms for each patient, evaluate the number of times they appear, and relate it to the waiting time until the first colonoscopy.